are using this meeting to set an agenda for the incoming administration, both at the level of ministries, parastatals, and agencies, and most importantly, the Federal Ministry of Health, and then to the National Assembly. For several decades, we worked to have the National Tobacco Control Bill, and of course, before the end of last Parliament, we have the National Tobacco Control Regulation. Part of the provisions of the National Tobacco Control Law, National Tobacco Control Act 2015, is the creation of what is known as the Tobacco Control Fund. The essence of the fund is to be able to have enough funding or resources to carry out activities that we know could roll back tobacco addiction and the ill health that are associated with tobacco use in Nigeria. Of course, we all know that about 16,800 Nigerians die every year as a result of tobacco use, and that there are necessary policies that government must carry out to be able to implement and enforce the law. But the problem has been the lack of enough budgetary allocation to the Federal Ministry of Health to carry out those activities. So we call this meeting to look at what obtains in other countries of the world, particularly not only to raise taxes on tobacco control, but that a percentage of that tax could be earmarked for tobacco control activities. And we call government agencies that are here, that are concerned, and we were all here in the morning to talk together. Essentially, there is an agreement that this is a problem that needs to be well resourced, and that stakeholders should now work together to ensure that a percentage of what government gets as levies from tobacco products should also go into tobacco control activities.
Without necessary funding, you cannot be able to raise up the kind of man or woman power to enforce the law. Two, the Act made provision for public and enlightenment and education of the citizenry. In terms of even monitoring monitoring of the tactics or the ways the tobacco industry is not, implementing the law, they need money to do this. So the whole money is for them to set up functional units to enable them carry out the implementation of that act.
The meeting was actually about conceptualizing and talking about tobacco tax earmarking, why tobacco tax earmarking, what should we do to get tobacco tax earmarking, and how should we approach the issue so that we can institutionalize and have a policy on tobacco tax earmarking. The meeting agreed on the following. One, that tobacco is a leading cause of death globally, and that the tobacco issue in Nigeria requires a urgent attention, especially with the various novel products and advertising methods that the tobacco industry are contriving in low and middle income countries, which Nigeria is one of. Two, that the burden of tobacco-induced diseases on public health of the country is high, and a concerted effort is needed to address the spate of tobacco-induced diseases in the country. Three, that according to global best practices and recommendations of various experts, that high tobacco taxes is the single most effective and cost-effective way to reduce tobacco use, and that the public health in Nigeria at the moment is underfunded, that its national health coverage and indeed tobacco control is in dire need of much more funding.